is Dr. John Gore, who's a urologist, another surgeon from the Department of Urology at the University of Washington. And Dr. Gore has been very interested in understanding and improving access to care and also evaluating quality of care, particularly around surgical outcomes. And he is also interested in helping to understand and manage side effects of treatment. So, Dr. Gore.
Thank you, Dr. Nelson, and good morning, everybody. I want to talk about some efforts that we've been working on for the last several years that are about to be brought into a very large audience, both locally, nationally, and globally. And it emanates from a concept called user-centered design, which you might also hear these terms like human-computer interaction, human-computer design, human-centered design. And it's this idea that if we want to build new tools, it's really important to engage the users of those tools as we build them so that our end product, our final product, is something that we know that target user can use. So in the case of what I'm going to talk about here, our user is the patient. And so there's this new concept of patient-centered outcomes research that is shockingly a fairly new way to consider how we would approach research. And part of that idea is that our research ideas come from patients, our research designs are created in partnership with patients, and then ideally our end products are usable by patients. So why is that important in prostate cancer? Well, we know that in terms of the outcomes of prostate cancer treatment and the side effects of prostate cancer treatment, it's one thing for me to ask you how you're doing and then come up with my synthesis of how I think you're doing. It's another thing for you to tell me how you're doing on a more anonymized report. And so this is work from one of the sort of founding fathers of quality of life research in prostate cancer 20 years ago that showed that physician report is notoriously terrible and underrepresents the magnitude of side effects of prostate cancer treatment. So it's really important to go to the patient and understand what the patient-reported outcomes are. So this is some follow-up work that we did where what we were trying to do was characterize typical trajectories of different symptom dysfunctions after prostate cancer treatment. So in this case, we're looking at urinary control. And this is your likelihood that after prostate cancer treatment, you are going to return to your baseline urinary control. And you can see that radiation, which doesn't in fact impact urinary continence that much, it's a very, very high likelihood of returning to your baseline control. But after surgery, if you make it to about 2.5 years after treatment and you haven't returned to your baseline urinary control, it's unlikely that you are going to continue to realize improvement. The concept behind some of these curves, and this is showing you curves for sexual function and for bowel function, is that in publishing these curves, we thought, well, gosh, we are creating these useful tools that not only patients can use, but also providers can use to counsel their patients. That the existence of these curves would somehow make care better or make communication between doctors and patients better. But we realized that that doesn't work. And there is a humongous gap between what we think patients should have access to and what they actually do have access to. When we started this project, we went to one of the local support groups and we asked a group of about 50 men how many of them had ever seen a prostate cancer quality of life survey. And 2 men raised their hands. And then we asked those 2 men, well, gosh, have you ever seen the results of your quality of life survey? And they said, well, no, we just filled out the survey and it sort of disappeared into this Raiders of the Lost Ark kind of warehouse. So there's a problem where if we want to create tools that are going to help men with prostate cancer navigate the side effects of the cancer itself or its treatment, we need to reconceptualize access to this quality of life data. So this is a design concept that emanated from several years of what we would say is user-centered design work. And that concept was this idea that we started with a simple question addressed toward prostate cancer patients. What are the questions that you yourself